You're tuned to Planet Vero Radio. I am Cindy Schwartz, and this is the Patient Partner Show. We're broadcast on Spreaker and then distributed on its platforms, and we're also on WCZR 101.7 FM Real Radio on Talk Radio. Jeannie Rose with me today. Jeannie, this is kind of a disturbing story for me because it is another one of those stories where this is happening in Florida right now as I speak, to a person, a pregnant lady who contacted me, who I know the story of whatever's been going on with her, that moved up to a different area in Florida. So she, at this point now, baby is due May 29th, from what I understand. And she had been getting prenatal care through midwives and a doctor, paying cash for that. The couple have excellent health insurance here in Florida. They were living in South Florida and then moved to another town further north. When she had moved, the lady was about 5.5 months pregnant and moved to another town, like I said, a little bit further north, and then tried to continue with prenatal care. Now, she couldn't continue to go back to the original doctor and the original midwives because it was too far away, and it just wasn't feasible to do that. So she took the good insurance that she has, and she looked around for prenatal care in the area where she is. And lo and behold, if you can believe this, Jeannie, in 2023, with good health insurance, she could not find, and she has not been able to find, a doctor whatsoever at all to take her as a patient, as a prenatal care patient, to deliver this baby for her. That person it's horrifying. That person has called, and I tried to help her with the limited knowledge that I have of prenatal care in Florida, and that person has called every entity that she can possibly figure out, both of us can possibly figure out in the last month at least, really cracking down to, former Governor Lawton Chiles, Florida, started the Healthy Start program for, and this is my opinion if I remember right, living here, to give really good prenatal care. A lot of these places were contacted, from what the people have told me, and she was turned down by everyone, by health departments, by a lot of different programs, taking her word for it. And some of it was because she has good health insurance. What the person has wind up doing is going to the local hospital for her prenatal care, which is basically non-existent. And then her option is, A, to walk into the hospital in labor, and then whoever's on duty is going to deliver the baby. Or B, the other option they've presented her with is to schedule being induced to have the baby. Now, this is supposed to happen this coming week, from what I understand, which is about maybe almost 2 weeks before the baby is actually due. And this is not the first case that I've ever heard of this happening, to schedule an inducement to, and this is all my opinion about this, is what, to get it over with, to get it at a better time frame. This fits into the facility's appointment calendar, whatever have you. I have never heard of this in my entire life. Of course, I'm, not still at the age where I'm going to have children, but you and I talked before we went on the air today about this, and I don't want to say back in my day, but back in my day, I mean, I know of people that went to doctors at 6 and 7 months pregnant and didn't have any problem whatsoever, people that didn't have health insurance, to find a doctor to care for them for the remainder of their term till they delivered the baby. And I'm just like, it's almost criminal as far as I'm concerned. Jeannie, what do you think?
I'm with you there, Cindy. I mean, I cannot believe in today's age that something like that is happening. I mean, prenatal care is so important. I mean, what are these people thinking?
Well, what are the programs thinking? What are the facilities thinking? I mean, that they're doing to these moms and these babies.
Right. I mean, you should be able to, if you move, to be able to find another doctor. That just totally blows my mind.
Me too.
A pregnant woman cannot find another doctor.
You know what I don't understand is, I don't know why the doctor, the original ones, didn't recommend people when they knew where the people were moving to.
Yeah, exactly.
I mean,
Exactly.
isn't that what systems do? I mean, it's like, okay, well, I can't take you anymore as a patient because, I mean, it's feasible. Now you're living 2 hours away. Well, I mean, you can't drive 2 hours to get to your hospital for care. I mean, I understand that, especially when you're in labor. I mean, that's I get that.
Yeah.
But don't you send them to somebody or figure out something before? I mean, and it was on insurance and, stuff all along. When I heard the story, I was just like, I was crying. I'm like, I hope this baby's okay.
Well, yeah, and I always thought that insurance companies would also help you find a doctor. I thought that was part of their services that they offered, was to help you find a doctor if you couldn't find one.
Mm-hmm.
So, I'm not sure for this woman who her insurance company is, but it would
I don't know either.
That they would be wanting to make sure that she got the care that she needed.
Mm-hmm.
Everyone involved. I mean, I don't understand it.
I don't either. And as far as I know, I have the whole story. I mean, I'm not mentioning names. I'm not mentioning, programs. I know, like I said, that there was a Healthy Start program here in Florida. I know that it's still valid today. I don't know what their involvement would be, if there would be any. I don't know. But I just am crying that this is the story, that this is the actual story of something that's going on. And it's not the first person that I've heard. This is kind of a severe case, but it's not the first person that I've heard in the last year that has gotten pretty horrific prenatal care from what the feedback that they gave me after the baby was born. I'm like, oh my goodness. But at least they had somebody there. You know what I mean? They were in a program, but still, if the program is that bad, I mean, don't we need to address it? Where do you go to even address this stuff? I don't get it. I know the one doctor, the last doctor that was the last hope for this couple, turned around and said, well, I'll be on vacation that week, so good luck. And that doctor didn't even recommend anyone. That was like the last one that they could have possibly gone to, and that doctor said, no, well, good luck. I'm going to be on vacation. I can't help you.
Well, and Cindy, can you imagine the stress that this couple is under?
It's total. That's exactly what it is.
Every ache and pain, every ache and pain that this young lady may suffer, they don't know what's going on.
Right.
And I mean, when you're pregnant, you're not supposed to be under stress.
Right.
And the very system that preaches that seems to be the one putting them under stress.
Right. And so the only alternative they have is to go to a hospital, and then you get whatever's there. So there's not continuing of care like it's the same doctor. I mean, like when I had my baby, it was the same doctor for the months or whatever, and they knew you for what. Right. So this still would have been a continuation of care for 4 months. That's a long enough time, right? I think, to take your measurements and your, blood levels and all that stuff. Anyway, it's just mind-boggling. It's just mind-boggling in 2023 that this care is backwoods medicine, is my opinion, still going on. And I don't know what the reasoning is. I don't know if it's liability. That's my opinion. I don't know what the reasoning is for any of it at all. And it just does not make any sense to me at all that this is what's happening to a person that is, 5 months pregnant now, a couple of weeks to the due date. And, good luck. Have a nice life. Wouldn't want to be you.
Right. I mean, and the inducing of labor, I mean, that has been such a hot topic in the past that this was being done for the convenience of the doctors and the hospital, and it wasn't supposed to be happening unless absolutely medically necessary.
That's what I would think. You and I are on the same thing. And it's my opinion that it fits into a schedule, and this is the regiment we use. And if you don't like it, and find somewhere else. Well, good luck with finding somewhere else. On that note, I'm going to say, please stay tuned to Planet Vero Radio.